Welcome everybody. I'm sure you're familiar with Dr. Ron Leaf. This is our third interview we've been fortunate to have with him. And today I'd like to ask you specifically with autism, what does treatment look like?
Treatment looks like very good teaching, outstanding teaching. We do applied behavior analysis is the technical term for what we do, and ABA, applied behavior analysis, really boils down to what is good teaching. So when we work with children, we're looking at what their areas of weakness are and their strengths and building upon their strengths, but looking at those deficit areas, and often in autism, some communication. So it's breaking communication down to small little parts and teaching them how to communicate more effectively. It's using motivation, so to help them want to learn to communicate. It's providing assistance as necessary. It's trying to get rid of that assistance so they can be independent. It's making teaching fun, and that's what we do. Good treatment is educational, is the basis of education, really systematic education, fun education, and that's what our treatment looks like.
There's treatment in homes. I understand people, it's not just at school though, right?
Treatment really needs to be from the time the child wakes up till they go to bed.
Okay.
But it's the formality that changes. Treatment should be fun, as I said, and it should be enjoyable for the child and enjoyable for the teacher, be it a parent or teacher in school. Mm-hmm. But our children need to receive treatment all day long to help speed up the process.
What kind of background or training should a therapist have before they enter into the job?
I think they need to understand what autism is, the myths about autism, as well as what's accurate about autism. They need to understand good teaching principles. It's something that we can help someone learn rather quickly, but it needs to be ongoing training, ongoing support. It's very difficult to learn to do this in some respects because it's very intensive and you have to be working with the child all day long, but it's absolutely doable.
So if a parent has a child with autism, they need to have therapy, right?
Treatment as quickly as possible, intensive treatment from someone that's well trained in dealing with autism.
Educating Children with Autism was a publication quite a few years ago, lots of research, and they said anywhere from 35 to 48 hours a week of intensive therapy. Do you agree with that?
Absolutely, and they also said 52 weeks a year. And again, not that a child needs to be in treatment, vacations are okay with time, but it needs to be intensive.
Well, I agree. Thank you.
Thank you, Joanne.